Wearing shades in the summer is not just about looking cool. It's partly about that, but that's not really the important part. It's your eye health that matters the most. And your eyes can be affected only by not wearing sunglasses, but by swimming in pools, cutting the lawn, accidentally getting sunscreen in your eyes. There's a lot to think about to protect these things when summertime comes. We've got your back this morning with some tips for keeping your eyes healthy as we close out the summer. Joining me now is Dr. Tom Wohl, an eye surgeon, ophthalmologist at the Fishman Eye Center, to tell us what to look out for. Thanks for joining us, Doctor. We appreciate it. Now, the sunglasses, I brought my Maui Jims over here, which is a decent pair of sunglasses. They cost pretty much money. And eyewear selection, sunglass selection is just a good place to start as we have this discussion.
Yes, I agree. So we want to talk a little bit about ultraviolet radiation because that's really the problem. And frankly, it's not just a summertime problem. You know, we have 365 days a year. The sun is the main source of UV rays.
Right.
These are rays that we know cumulatively can damage the skin, cause skin cancer, but they can also damage your eyes over time. They can lead to eye cancers, cataracts, macular degeneration.
Eye cancers, so we're really talking about more than just your eyes sort of stinging or having a bad reaction for the day. There can be bad long-term consequences.
Yeah, it's difficult. You can have an acute reaction to too much sun in a day, but the bigger danger is really over the years, and that's why we want to kind of really raise awareness about sunglasses as sun protection.
When should you wear sunglasses?
Well, if you really want to be safe, and if you work outdoors, if you're fair-skinned, you're more susceptible to sun damage, you really should wear them every day of the year.
Yeah, and like I said before, I brought my pair along here with the brand name Maui Jims. They're very popular. And to be honest with you, I sort of paid a lot for them, which I didn't used to do. What I used to do was buy on New York City street corners those $4 sunglasses they sell, which strangely enough have been $4 for like 30 years. It's like the one product in the world that never goes up in price. Would you say you get what you pay for when it comes to sunglasses?
You get a lot more consistency if you pay more. I think you can find a good quality lens without paying a lot. I think you just need to look at the lens.
Yeah.
Find a vertical line to look at and move that lens back and forth. If there's no distortion, no wiggle in that line, it's probably a decent lens.
So there is a technique for testing out the lens. The other technique that I've found is if you get a headache from wearing distorted lenses too long, you probably have a cheap pair of sunglasses right there. Let's talk about other aspects of eye health. It is the bane of beach goers everywhere. You know, you don't want to get sunburned on your forehead, so you put it up above your eyes, but then you risk having the sweat bring that sunscreen down into your eyes, and it is torture. What do you do with sunscreen and your eyes?
Yeah, it's I don't have a really good tip for that. I think it is, wearing a hat can be very helpful because I think the sweat really brings a lot of the sunscreen down.
Right.
As it kind of trickles down. But if you get sunscreen or anything else in your eyes, the most important thing is you just have to rinse your eyes.
Rinse your eyes. Just go and get cold water and rinse them out.
Yeah, tap water's fine. Even a pool, just dive in the pool. You're going to be a little sore usually, but occasionally these chemicals can cause a more serious reaction, kind of a erosion of the surface of the eye, and that could lead to an infection. So I would say if you have pain that's not going away for several hours, it's probably a good idea to have it looked at.
Let's talk finally here about the other kind of danger that you face, which is objects going in your eyes. Specifically, want to talk about things like mowing the lawn, doing cleanups around your house, the need to wear goggles. What do you see in your work concerning that?
Yeah, well, it's a bad injury to suffer, so you really you got to take eye protection seriously. Mowing the lawn isn't that different from drilling or sawing or sanding or more mechanical type things where we just assume we should wear eye safety. You got to get a good pair of safety glasses. You know, it's too important an item to just leave to chance.
Yeah, get them and wear them. We got some tips here, Doc, that we're going to take a look at right here to see where else we need to touch base. Wear sunglasses. We already talked about that. Keep your hands away from your eye, which I think is a good rule year-round because it spreads infection as well as the possibility of injury. Used water-based makeup. Why does that matter?
Well, it just oil-based products are harder to clean. So if you use a lot, especially around the eyes, it can clog the pores and make the whole environment different, which can lead to bacteria and things like that.
And finally, you say keep hydrated, which is much the same reason, right? Just
Yeah,
keep
it improves
everything
your tear
flowing.
film, your
and,
health,
yeah.
the health of the tears.
All right, good tips. Now, you can't just take the tips and just think about them. You actually have to wear them and put them on. So hopefully you raise people's awareness about this a little bit. Doctor, thank you very much. Appreciate it.